Hello, this is Alfred Brock with the Wayne Focus, and today we're going to be talking about seeking drug abuse, know what to ask. And this particular document has been brought to us by the National Institute on Drug Abuse, and you can find that online through the United States Department of Health and Human Services. If you're looking for assistance, if you're seeking drug abuse treatment, know what to ask. If you're looking for drug abuse treatment, just take a look online at the U.S. Department of Health and Human Services or in your own state. So we're going to do some background information here and talk about this for just a couple of minutes. So, seeking drug abuse treatment, know what to ask. The goal of drug abuse treatment is to stop drug use and allow people to lead active lives in the family, workplace, and community. That's what it's all about. One continual challenge, however, remains is that keeping patients in treatment long enough for them to achieve this goal. A lot of people go in and they get themselves, they call it cleaned up sometimes, and they go in for 7 days, 15 days, or maybe they're sentenced to that. If they're sentenced to that in some courts, 15 days or 20 days, and that is not enough to totally take care of the drug abuse treatment that's necessary. Now, finding the right treatment for a person's specific needs is critical. Drug abuse treatment is not one size fits all, and there's all different types of treatment. Treatment outcomes depend on the extent and nature of the person's problems, appropriateness of the treatment for the particular individual in the particular situation that they're in, and that the person follows up with that. The availability of additional services to go along with that. If a person finds out that they have further physical or mental difficulties, they're going to need some assistance taking care of that as well. There's also an issue with the quality of interaction between the person and his or her treatment providers. Family and friends can play important roles in motivating people with drug problems to enter and remain in treatment. However, trying to identify the right treatment programs for a loved one can be a difficult process. Sometimes you need a professional, and that's why we have social workers, doctors, psychiatrists, and others. And reaching out to them, even if you're not the person who's having the particular difficulty, if you're in a family or a friend, reaching out to them and getting the information that you need can be very helpful. Now, to help in this, we're speaking right now about the National Institute on Drug Abuse. They created this brief guide containing 5 questions to ask when searching for a treatment program. I'm going to go through the 5 questions. So let's go. Number 1, does the program use treatments backed by scientific evidence? Now, effective drug abuse treatments can include behavioral therapy, medications, or ideally their combination. That's everything put together. Behavioral therapies vary in focus and may involve addressing a patient's motivation to change, providing incentives to stop taking drugs, building skills to resist drug use because they're coming out of society where it's very acceptable and pushed on people literally to use the drug. So getting those skills to resist that is very important. Replacing drug-using activities with constructive and more rewarding activities, being reintegrated into society, into the local economy, etc. Improving problem-solving skills, and building better personal relationships. So there's a lot of work that goes into that. So examples of behavioral therapies include cognitive behavioral therapy, motivational incentives, motivational interviewing, and group therapy. There are others as well. Medications are an important part of treatment for many patients. Not everyone, but many of them, especially when combined with counseling and other behavioral therapies. So you won't just want to pick one thing and say, oh, that's going to be the panacea, that's going to be the thing that's going to solve everything. So medication and all these other things are very important to combine and put together. Different types of medication may be used at different stages of treatment. For example, to stop drug abuse, later to stay in treatment, and to avoid relapse. Let's move along. Okay, question number 2. Does the program tailor treatment to the needs of each patient? So this is number 2. No single treatment is right for everyone. The best treatment addresses a person's various needs, not just his or her drug abuse. So matching treatment settings, programs, and services to a person's unique problems and level of need is key to his or her ultimate success in returning to a productive life. It is important for the treatment approach to be broad in scope, taking into account a person's age, gender, ethnicity, and culture. The severity of addiction and previous efforts to stop using drugs can also influence a treatment approach. The best programs provide a combination of therapies and other services to meet a patient's needs. In addition to drug abuse treatment, a patient may require other medical services, family therapy, parenting support, job training, and social and legal services. Finally, because addictive disorders and other mental disorders often occur together, a person with one of these conditions should be assessed for the other. And when these problems co-occur, treatments should address both or all conditions, including use of medications as appropriate. And we have some other documents, and there's visual aids in here. We're not going to go over that in this presentation, but you can find them again by searching for the United States Department of Health and Human Services or the National Institute on Drug Abuse, your own state medical health group. And we're talking about seeking drug abuse treatment, or what to ask. Now we're up to question number 3. 3. Does the program adapt treatment as the patient's needs change? Individual treatment and service plans must be assessed and modified as needed to meet the changing needs, right? A person in treatment may require varying combinations of services during its course, including ongoing assessment. For instance, the program should build in drug monitoring so the treatment plan can be adjusted if relapse occurs. For most people, a continuing care approach provides the best results, with treatment level adapted to a person's changing needs. A patient's needs for support services such as daycare, transportation, and other things should also be met during treatment. Question number 4. Is the duration of treatment sufficient? This is very important to consider because, as I mentioned, they call it a drying out condition or whatever, getting someone sober is different than the treatment that we're talking about. We're talking about completely exiting the drug society and becoming integrated again into the general society. Now, number 4, is the duration of treatment sufficient? Remaining in treatment for the right period of time is critical. Appropriate time in treatment depends on the type and degree of a person's problems and needs. Research tells us that most addicted people need at least 3 months in treatment to really reduce or stop their drug use, and that longer treatment times result in better outcomes. The best programs will measure progress and suggest plans for maintaining recovery. Recovery from drug addiction is a long-term process that often requires several episodes of treatment and ongoing support from family or community. It is not necessarily a never-ending situation. There is a process, and one can heal. Now, number 5. How do 12-step or similar recovery programs fit into drug addiction treatment? Well, self-help groups can complement and extend the effects of professional treatment. The most well-known programs are Alcoholics Anonymous, Narcotics Anonymous, and Cocaine Anonymous, all of which are based on the 12-step model. This group therapy model draws on the social support offered by peer discussion to help promote and sustain drug-free lifestyles. Most drug addiction treatment programs encourage patients to participate in group therapy of some kind. During and after formal treatment, these groups offer an added layer of community-level support to help those in recovery with abstinence and other healthy lifestyle goals. I know here in my local area we have groups that are working over in Ann Arbor, Michigan, and it's just so wonderful. There are social groups. I've met several artists, several musicians, and all sorts of other professionals that are working together, and they maintain a sober community. It's really quite amazing. Full selection of everything that you could possibly want, with the knowledge that there's not going to be any drug use. That's just not going to happen. And so sober living and sober community social support helps so much people in recovery. So again, we were taking a look at seeking drug abuse treatment, know what to ask. And we were reading about information provided to us from the National Institute on Drug Abuse. And again, this was from the United States Department of Health and Human Services. Your own state is going to have a Department of Health and Human Services. They should have materials similar to this and all the support that we were just talking about. And again, social workers and other agencies and groups and volunteer groups in your area will help you with seeking drug abuse treatment. So please reach out, get that. And there you go. Thank you very much. This has been Alfred Brock with the Wayne Focus, talking about seeking drug abuse treatment. Know what to ask.